Remote monitoring is the future. There is no doubt about that. It is the future of healthcare delivery. It allows you to interpret the condition of the patient and act early. And I think acting early here is very, very important. So whether the patient's at home or they are in the ambulance or they're in transition care or hospital wards, to be able to see what's happening with their cardiorespiratory system or their mobility, it allows you to interpret the condition, whether it's worsening, getting better, and act early. So I'm very pleased that players like Dozee have come in that space and they have done a remarkable job so far. The concept of the early warning system is not new. When I was working in the UK about 20 years ago, people realized that we needed to have a system, a scoring system whereby, if you're monitoring heart rate, you're monitoring respiratory rate, you're monitoring, the urine output and stuff like that. But then, in that system, what you had was that you have the blood pressure or the heart rate or the vital parameters taken every 6 hours or every 4 hours or sometimes every 2 hours, which is quite labor intensive. And then somebody had to score it down and raise the alarm. But if this could all be automated, and that was the whole point of going further, and that's where I think Dozee came in quite nicely, that all this system is now automated. You are producing a score, or you are comparing it with News 2 score, which are the well-established scores, and you are able to then act quite effectively and quite promptly. In my experience, very recent experience in India, when we put this system in place in our hospital, we could see that not only nursing efficiency improved significantly. In fact, some data suggested that we could save 1 hour per 8-hour shift per nurse, which is quite a significant. But what happened to the patients, which is really very, very important, is that we could see that our rate to the intensive care unit reduced to 50%, and the blue code calls, which is the emergency calls, came down in the hospitals by up to 50. So different hospitals, reported different figures. But on the average, it came down by 70%, 50 to 70%. And in some hospitals where all the beds were monitored for a period of time, when we looked at data, the blue code calls came down to 0. So I think not only that the hospital efficiency improved, but we could see that the patient outcomes improved. I think that's quite a significant thing. Now, in the US, transitional care, which is the care between the hospital and the home. Similarly, in the UK, we're talking about virtual wards, which is the ward, the care being provided in nursing homes or at patients' homes, but then they're trying to bring the standards as if the patients were admitted in the hospital. It will be good to be able to monitor them 24/7 so that if there was any issue, it can be picked up early. So the way I envisaged and implemented that in India was to have a connected care system. We called it enhanced connected care. So that irrespective of the geographical location of the patient, they were being monitored and all their parameters were looked at in a central command center, so that somebody was making sure that the patients were monitored. And if there was an early warning sign, they could go back to the healthcare giver and say, hey, can you please look at this patient and see, if things are. My message to Team Dozee is that, well done, and let's keep it agile, let's keep it flexible, let's keep it adaptable, and let's listen to all the different healthcare givers in different parts of the world as to what their requirements are, and then build our system to meet those requirements, which is what Dozee has done so far, which is take clinical advice, understand what clinical problem is, and then build and adapt your system. I think once you've done that, which you are doing, of course, you have nothing but success to look forward to. So what I would say to anyone, any healthcare deliverer who are on the journey of remote monitoring and early warning and then intervening early is that, like any other new system, there are things that one has to understand, one has to learn, and systems you have to put in place in terms of clinical governance. Once you've done that, then you are sailing. And I think transition care is such an important area of care where the idea is to keep patients as much away from hospitals as possible, which is great. And then to look after them to the point where it meets the standards of a typical hospital, which is also great. So monitoring them and intervening early, that philosophy really works very well in transition care. I think there is huge scope there. I know the transition care systems have their clinical governance processes in place. I think the challenge and also the opportunity there is to see how systems can be automated so that you are able to keep the same clinical governance structure, but you're able to pick up any deterioration much earlier and intervene much earlier so that repeated trips of patients from transition care to hospital are minimized and patients are cared for much more effectively in the environment where they belong. I wish Dozee good luck, and everything, everything, as good as possible for this to go even further. I'm sure sky is the limit. Dozee has already crossed geographical boundaries, and I wish them all the luck in now crossing the boundaries that we artificially create amongst our clinical care systems to see that our patients get the best possible care that they deserve.